I invite Yashni for a warm welcome speech. Yashni?
Yes, yes, I'm here. A very good evening to all. So today we are in the 29th session of our Conceptual Truthing Age 2.0. On this wonderful occasion, we have Dr. Narayan Debnath as our resource person. Dr. Narayan Debnath is a former executive committee member of Central Council of Homeopathy, New Delhi. He is the Dean Faculty of Homeopathy of SSUHS, Assam, India. And it's our pleasure to welcome you, sir, to the students program. And we are so eager to hear from you on the topic homeopathic treatment in children for the beginner. So I welcome everyone to this webinar, and sir, it's over to you, sir, for a beautiful session. Thank you.
Good evening to everyone. And I thanked the organizer for giving me opportunity to be here with you. And my topic is
Hello, sir. You are not audible.
now audible.
Yes, sir.
Yes,
Now you're
sir.
audible.
I think your video is off.
No.
You are not visible. Okay. Screen sharing. Okay.
My topic is homeopathic treatment in children for the beginners. Herein, for the beginners means the organizer told me that this seminar is for the students mainly, and I thought that how a student can appear before the children patient for their better treatment or for appropriate treatment as a beginner practitioner. This is the motto of this session or of this topic. You all know, my lovely students, that treating a patient in homeopathic system of medicine need knowledge in different points. Say for an example, knowledge in appropriate case taking, knowledge in finding out the totality of symptom, knowledge in evaluation of symptom, knowledge in diagnostic point of view, diagnosis of disease, and in homeopathic point of view, miasmatic diagnosis. Then we come to the point in terms of selection of medicine. After selection of medicine, selection of potency, selection of proper dose, selection of repetition. These are the different ways, or you can say it is better to say different steps for a selection of medicine. But in case of children or in case of infant, all these steps become very difficult in practical purpose. Theoretically, it is very easy, but practically it is very difficult to find out all the relative information for the appropriate selection of medicine. Hence, in case of children, we have to depend on these 3 points observation of the physician, that is what are the point observed by the physician to a children. Next important point, comment of the parents. Sometimes from the comment of the parents, we get important clue or important point relating to the comment of the parents to convert into the symptom of materia medica. Another important point is attitude of the children. Herein attitude means thinking on feeling about something. A settled way, better way we can say, a settled way of thinking on feeling about something. What is the feeling of the children in a particular topic or in a particular situation, how he expressed. If we observe these three things, especially in case of children, or we collect the indication for selecting medicine on the basis of these three things, it would help enormously in our initial practice or those who are the beginner as a practitioner, we can say. Now, a baby born and the parent complaining that the baby is not passing urine since his or her birth already it become crossed 24 hours, 72 hours. In this way, the parents will express before you. Baby born 72 hours earlier, but till now, he or she had not passed any urine and the family become anxious. In this regard, Dr. Kent said, our only and important medicine for the retention of urine in newborn infant, the name of the medicine is Aconitum napellus. Dr. Kent also explained in this way. As we all know, aconite is one of the important medicine related to the change of the temperature, or issues, or you can say any complaint appear due to the change of the atmospheric temperature. It would be appropriate to say the complaint appear due to atmospheric change, then aconite is one of the most important medicine we all know. Herein also you can think in this way, that while the infant or baby, whatever you may call, it is into the mother womb, he or she got the temperature of the mothers. Now, as soon as his or her born, he is in this world, you can say, and the temperature of this world is different. And can be explained in this way, mostly newborn babies suffer from retention of urine due to this atmospheric change, and for which The best medicine is Aconitum nepellus. If you go through the Kent Materia Medica, you will get it. Next, you say, after born of the infant or baby, whatever you may call, the next important point you have to face in your practice life is related to the feeding of the baby or feeding of the infant, whatever you may call. The most common thing you will get in your practice life that in the mother's breast there is no milk. First symptom you will get, or first, it is better to say, first complaint you will get from the parents that there is no milk into the mother's breast. And for this, you have to remember at least 4 or 5 medicine in your early practice life. These medicine are Lac caninum, Artica urens, Asafoetida, and Agnus castus. Another medicine is Dalcamara. Herein I have noted milk disappearing. There is lack. This means lack of milk into the mother's breast or lack of milk. Herein I have noted 3 medicine. Another 2 medicine you try to include. It has, you can say, while preparing slide, I have forgotten the other 2 medicines name, that is Asafoetida and Agnus castus. These are the most important remedy for the loss of milk or lack of milk or disappearing of milk into the mother's breast. Another group of patient you will get that there is excessive flow of milk or excessive accumulation of milk into the mother's breast, for which you try to remember the medicine mostly Lac defloratum. And next, other important remedy, as per symptom similarity, you have to select the medicine. But I want to say, these are the commonly and frequently used medicine for this topic. Lac defloratum, borax, rustox, aconitum, pulsatilla, calcarea carb, bryonia, and belladonna. The next complaint parent will do before you, or next type of symptom you will get related to the feeding, that is most commonly aversion to mother's milk. The parents will complain, or patient party will complain, the baby does not want to take mother's milk. Then the medicine will be the Sina. Another group of patients will complain aversion to milk. That means baby is not interested to take any form of milk. It may be the cow's milk, it may be the goat's milk, it may be the artificial milk, or it may be the mother's milk. In those cases, you have to remember at least 3 medicine: calcarea carb, calcarea phos, and silesia. in rural area, we have seen in our practice life, even patient party complaints regarding the mother's milk, or you can say, better to say, taste of the mother's milk. When the baby does not wants to take mother's milk, many of the old grandmother, you can say, they taste the milk, and many of the patient complain the milk tastes bitter, milk is thin, and milk is very thick. In case of, if they complain that milk is bitter, then you have to think the name of the medicine is borax. And if milk is very thick, then also medicine is borax, calivicron, and phytolacca. And if it is very thin milk, then you have to think about calcarea phos and phonium. Next complaint you will get most commonly in your practice life, that matter related to the neonatal jaundice. We all know that when bilirubin excess of 2 milligram per 100 ml of blood, then we may call the patient suffering from jaundice. But in case of neonat, generally they suffer from jaundice at the age of 2 to 4 days due to hepatic immaturity. Due to hepatic immaturity, neonat may suffer from jaundice, then we may call it physiological jaundice. Jaundice appearing within 24 hours of birth due to hemolytic disease. This hemolytic disease is, you can say, breakdown of RBC due to RH incompatibility, and in these cases the baby suffer from generally anorexia, nausea, lethargic, disinclined to take food, and their stool may be green, and also suffer from with dark urine. For this neonatal jaundice, in most of cases, it is physiological, and the baby become normal within 5 to 7 days. But when these symptoms disturb the baby, this symptom means this anorexia, nausea, lethargic, disinclined to take food, dark green stool, and dark urine, then we have to think about the treatment of the baby. And in most cases, it has been observed that phototherapy is essential. Along with phototherapy, we may treat the baby on the basis of his or her other symptoms. And most commonly, I should not utter like this, most commonly, but for the interest or betterment of the students, you can say I am discussing in this way. Most common medicine I have used in my practice life is natrum salt, and it is my observation, you can say personal observation. Natrum salt in biochemic form or lower potency, if you give, it helps the infant or neonate, whatever you may call, to improve his neonatal jaundice. And the other common medicine, it may be the cheridonium, it may be the ipecac, it may be the hydrastis, or you can say any medicine may come for on the basis of symptom similarity, but it is totally personal observation. The natrum salt works very miraculously in this neonatal jaundice. Sometimes on the basis of symptom, even I have used the aconitum napellus, but in most of cases, I have got good result with natrum salt. The next common symptom or complaint you will face in your early practice life, or you can say in your practice life, it is umbilical sepsis. And this umbilical sepsis occurs due to contamination of umbilical cord. Due to contamination of umbilical cord, which leads to omphalitis, and in some cases abdominal wall, in abdominal wall you will get the erythema and swelling. These are the erythema and swelling along with this umbilical cord inflammation, redness, swelling, or septic condition. This mostly occur due to contamination of umbilical cord, and the most common causative organism is E. coli, streptococci, staphylococci. Herein also, these are the common medicine which is frequently used for the treatment of umbilical sepsis. Obviously, it should be on the basis of, you can say, totality of symptom. But most commonly used medicine is calcarea phos, calendula, silicea, gunpowder are the commonest medicine used in umbilical sepsis. Other medicine also, you can say abrotenum, dalcamara, mercurius, hipersal. I am confident that as a beginner, if you remember these medicine, abrotenum, calcarea phos, dalcamara, mercurius, silicea, hipersal, gunpowder, and calendula, it will help you immensely in your practice life. And even many physicians I have seen that externally they used calendula powder, or you can say some physician used calendula ointment externally for this umbilical sepsis. And such kind of patient, if you will get mostly in case of rural area. Next common complaint or baby with common complaint you will get in your practice that is related to the vomiting. And the most common cause of vomiting is birth trauma. Commonest cause, you can say, in early life of baby or in neonatal stage. The commonest cause of vomiting is birth trauma. I think you have heard that when someone gets head injury, and if after head injury someone vomits, it is a dangerous signal related to that head injury. It may cause severe brain damage, etc., etc. In that way, if a infant suffer from vomiting without any other specific cause, you have to alert that he or she may suffer from birth trauma, especially in case of neonate. The other cause related to the birth trauma is great fear and anxiety. Even if the baby suffer from any sudden fear or any sudden anxiety, he may also suffer from with vomiting. The other common cause is indigestion of food or underfeeding and overfeeding. Overfeeding may also cause nausea and vomiting. Underfeeding also cause nausea and vomiting. The other important cause is gastroenteritis, esophageal reflux, intestinal obstruction. Those who are the student of, I think, of third year, they may easily understood what is the intestinal obstruction, and most common indication of intestinal obstruction is vomiting, you all know. Next important cause for vomiting in case of infant or children is esophageal reflux. This esophageal reflux, you simply try to understand that due to excess acid and bile in the esophagus, or you can say the better to say digestive in digestive tube, there is excess acid and bile which causes the irritation, and for which the baby may suffer from vomiting. And another important cause is in case of neonate is ingestion of blood and mucus. This ingestion of blood and mucus means those who also pass the third BHMS, they know that the baby may suffer from, in mother's womb, you can say, from ingestion of meconium, or this means it is mixed with blood and mucus. And if the baby took this blood and mucus, your mistress may suffering from vomiting or nausea. Now, for this vomiting and nausea, most common medicine you will get in your practice life. For the medicine is arsenic album, ipecac, antidote, next Bhumika, Bismuth, Ithuja. These are the commonest medicine you will get in your practice life related to the vomiting of infant or children. Now, in case of Ithuja, you have to remember simply the word card-like vomiting and prostration. Just try to remember these two words. Card-like vomiting and prostration, and the baby cannot tolerate milk in any form. And in case of arsenic, this arsenic you will get in case of children. It is better to say the baby wants to take water frequently but in small quantity. We may call, for better understanding, little quantity, little interval, which is just opposite to the bryonia. Large quantity, large interval. Great thirst for large quantity of water at long interval in case of bryonia, and for memorizing, or you can better to say better understanding, sometimes we call large quantity, large interval, large quantity, large interval. And for interval, you understood, we never use the word large. But for memorizing the large, some student or teacher gives the indication large equal to bryonia and little equal to arsenic for differentiating. Little quantity, little interval. Better in grammatical language, it is better to say little quantity, short interval. And for memorizing or understanding, little quantity, little interval. Is related to the arsenic, and large quantity, long interval is related to the bryonia. This indication, along with the great prostration of the arsenic and other, you can say, mental symptom in arsenic related to the anxiety and fear, will help you select in arsenic. And in case of bryonia, we also called bryonia is nothing but dryonia. Dryonia means, bryonia is also called dryonia. For this, dryonia means dryness of all mucous membrane, dryness of all mucous membrane from mouth to anus. So what will happen? By remembering this word dryonia for the student, by remembering this word dryonia, you please try to revise or try to give a revision for bryonia today. Then you will feel how this dryonia will help you for selection of bryonia, because this dryness of mucus resulting the hard stool of bryonia, this dryness of bryonia resulting the aggravation from any movement. Okay, I would like to stop here bryonia. Now you see, but I will request you, by understanding the word dryonia, you try to revise Bryonia today night, and you will feel that this dryness will help you to memorize or for better understanding Bryonia medicine itself as a whole. Now that you see, the next important medicine you will get in case of vomiting is bismuth. And for bismuth, the most common indication for you is whenever the bismuth baby or bismuth patient, whatever you may call, they take the liquid food, it vomits out immediately. Say for an example, I am taking a half glass of water and I have thrown it immediately, or within short period I would vomit it. But if I take the solid food, now I have taken a solid food, I would vomit it tomorrow morning or tomorrow midday, tomorrow evening. That means simply try to understand. The liquid food vomit out by the patient immediately, but solid food remain for a long time and then vomit it. In case of arsenic, you have to remember another important point, that is arsenic baby or arsenic patient cannot tolerate, it may be the liquid or solid, it would thrown out as soon as it touches the stomach. That means in case of arsenic, if I am an arsenic patient, whenever I would take any liquid or solid food, it would thrown immediately. That immediately equal to arsenic. And in case of bismuth, solid food retain for a long time, but liquid food thrown out immediately. And in case of Ipecac, you have to remember for differentiating, you have to remember in case of Ipecac, the two word only, whatever written in the book. First, you try to remember or memorize or understand whatever you may call the two word. Number one, nausea. Nausea in case of Ipecac. That means constant nausea. Constant nausea and vomiting without giving any relief. Constant nausea and vomiting without giving any relief in case of Ipecac. But if you remember the word nausea, vomiting you understood, but what is nausea? This nausea means feeling of vomiting. Feeling of vomiting, we may call the word nausea, and the nausea is most prominently you will get in Ipecac. Even after vomiting, in most of the medicine, you will get the patient or baby, infant, whatever you may call, they will get some sort of comfort, or at least comfort for a few moments, few minutes. But in case of Ipecac, the patient or baby will not get any sort of relief even after vomiting. There is constant nausea, and nausea means feeling of vomiting, you can say. Before vomiting, we do some kind of sound. This is called nausea feeling or nauseatic feeling. Now, in case of Ipecac, most prominent word is this nausea, and next important word is clean tongue. These two words, nausea and clean tongue, will help you differentiate, to make differentiation with other medicine in case of Ipecac. And in case of antimeter, you will get vomiting in any position except lying on right side. Rest of the word, whatever written into the book, first you try to remember this line: vomiting in any position except lying on right side. In any position, baby feel comfort, discomfort, sorry. In any position, baby feel discomfort, but in case if the baby lie on right side, he or she feel vomiting. The next commonly used medicine, especially in case of adult, that is nux vomica. And in some cases, you will get related to the vomiting, nux vomica is also important remedy. You just see, in case of causation of vomiting, in case of infant children, I have told that over feeding is one of the important cause for vomiting in case of children or infant, whatever you may call. And underfeeding is also important cause. For this overfeeding, two medicine is important in case of children related to the vomiting. That is antim crude and nux vomica. It would be very lengthy if I continue in this way. Okay, I will try to make it compact, or you can say brief. In case of antim crude, you have to differentiate it with its tongue and irritability of the baby. Antim crude tongue, a thick milky white coated tongue. Thick milky white coated tongue. Simply, you try to understood. If you ask the baby, please open your tongue, then you will observe that tongue is bright white color. Bright white color, you can say, for understanding. Or you can say in the tongue, there is a white paper lying on it. This symptom, along with irritability, extreme irritability, will help you to identify that it may be the antim crude. And in case of nux vomica, you heard the word or sentence. The patient says, if I could vomit, I would feel better. And in case of baby also, they put the finger to induce vomiting, because vomiting gives relief. In case of nux vomica, baby had, for adult also the same symptom. Vomiting gives relief, but try to recollect that in case of ipecac, I told, there is no relief even after vomiting. There is constant nausea. It is just opposite in case of nux vomica, that the baby feels comfort after vomiting. Another medicine you will get it in your practice life, or such kind of patient you will get in your practice life, that is phosphorus. Try to recollect. In case of arsenic, I told it vomits out, whether it is solid or liquid, as soon as it touches the stomach. But in case of phosphorus, It is, you will get in your books that anything or whatever the patient takes, when it becomes warm into the stomach, it's thrown out. When it becomes warm into the stomach, it's thrown out by the baby or infant. Now, say I am a phosphorus patient. Whenever I took anything, I vomit it after 5 minutes, 10 minutes. This means when I took anything, when it become warm into the stomach, it thrown out, the medicine is phosphorus. I have understood that, or you can say not understood, it would be better to say, for this reason, I always like to take cold things or ice. Phosphorus patient craves for ice. This will also help you to memorize, because ice will take long time to become warm into the stomach, and the food would retain into the stomach for a long time. In this way, you can remember the phosphorus. I would like to say I am in hurry because you can say this simple topic or one topic has taken much more time. Now, the other medicine is colchicum. It is not noted. Oh, yes, it is also written into it. Colchicum, pulsatilla, veratrum album, sina, pyramid. In case of sina, you will get this nausea, vomiting along with sina, clean tongue, typical clean tongue, sina desire. Along with its other symptom of sina, you may compare with other medicine. In case of veratrum album, it is mostly related with the prostration and sweat of particular veratrum album. Pulsatilla also cannot tolerate any kind of fatty food, etc. Trustlessness in case of pulsatilla. Baby is suffered from pitiful cry. In this way, if you remember, with differentiating these medicine, especially related to the vomiting, I think, and I am confident that it will help you immensely in your practice life if you remember this medicine with the comparison. Clear? And in case of Saramet, also one peculiar symptom you can remember that in simple way, try to remember. Say someone suffering from vomiting, he sits for his dinner, lunch, whatever you may call. He has taken with great satisfaction, and he has taken in full abdomen, and suddenly he will vomit everything, and again he or she will start eating. Clear? Simply, patient vomits everything while eating, and after vomiting, he or she start eating again with comfortably. In this way, please try to remember this medicine. It will help you great in your future practice. Next common symptom, or not symptom, or common problem or disease, or whatever you may call, you will get in your practice, that is a diarrhea. For diarrhea, in your practice, you will observe that if the baby passes some loose stool, parent becomes anxious, they suddenly rushes to doctors. But as a doctor, you have to remember that if the baby suffer from one or two loose stool in a day, there is no need of medicine. But if the baby suffer from more than 3 loose stool in a day, then you have to alert, and then we may call it acute watery diarrhea. And lasting of 14 days or more is known as persistent diarrhea due to intestinal infection, any complication, or lactose intolerance. If the baby suffer from more than 14 days, 2-3 stool continuously, then you have to alert. And when the baby suffer from rice watery stool with severe dehydration, especially above the age of 2 years, is known as cholera. This means simply if the baby passes 1 or 2 loose stool in small quantity, not to worry. But if it passes 7 to 8 times loose stool and the baby become tired, then you have to alert and start your treatment immediately. This is the most common phenomenon. Whatever may be cause of diarrhea, you may alert. And the most common homeopathic medicine in case of diarrhea is your aloe sock, natrum sulph, bryonia, nux vomica, thuja, podophyllum, sulfur, ethuja. The most common medicine you will get in your practice is, I repeat, aloe sock, natrum sulph, bryonia, nux vomica, thuja, podophyllum, sulfur, ethuja. The other medicine is acid phosphorus, senna, staphysagra, arsenic, argentum nitricum, megarum, natramur, pulsatilla. Again, the other important medicine you can say, Calcarea carb, Chamomilla, Ipecac, Mercurius, Phosphorus, Rheum, Stramonium. But I would suggest you, for your early practice life, for gaining your confidence, please never try to forget the name of aloe sock, natramur, bryonia, nux vomica, thuja, podophyllum, sulfur, ethuja. Another medicine is acid phos. It is my personal experience as a teacher, as a practitioner. I repeat, you can remember any medicine from aconite to veratrum album noted into the materia medica. The list of medicine may be the 100, but my request to you, for your early practice, never forget the name of Allosoc, Natransal, Bryonia, Naxponica, Thuja, Podophyllum, Sulfur, Ethuja, and acid phos. Now, why? What is the indication of this medicine? In Allosocotrina, simply you try to understand that there is lack of confidence in the sphincter ani. If you remember this word, along with jelly-like mucus, 90% symptom of Allosoc you'd able to remember. For the students only, please, by remembering these two words, lack of confidence in the sphincter ani, along with the jelly-like mucus. By remembering these two words, go through the any book. It may be the Allen's keynote, it may be the Boris, it may be the Kent, whatever may be the book. By remembering, preconceive or pre-remembering these two words, you study the Allen's keynote related to the abdominal complaint, diarrhea, dysentery, whatever you may call, you will get that majority of the symptom is covered by understanding of, covered on understanding of, better to say on, not by, on understanding of these two words, jelly-like mucus and the lack of confidence in the sphincter ani. Lack of confidence in the sphincter ani means, I think you understood, there is lack of confidence of sphincter ani means anus is not able to contract properly and it cannot hold the content inside it and it comes out easily. And this jelly-like mucus means it helps intestine. If the inside of intestine, most jelly, not most, the excessive jelly-like mucus, then it would come out easily due to excessive peristaltic movement. I am uttering this word peristaltic movement for your understanding only, but peristaltic movement related our medicine in case of materia medica related is another medicine. It is better to say I feel some sort of discomfort to make you understood easily. I think, hello, I think you understood the words related to the lack of confidence in the sphincter ani. Now, along with the lack of confidence of sphincter ani, there is excessive mucus membrane, not membrane, excessive jelly-like mucus into the intestine. That is why the patient suffering from patient cannot control the urge of stool. Whenever the patient feels urge of stool or whenever the patient takes food, the patient has to go to the toilet immediately. But in case of Allosoc, you have to remember another important point, that is driving out of bed early in the morning. That means in the early morning, the patient feels feel urge for stool and the patient cannot control, for which you have to remember or you have to compare minimum 5 to 6 medicine driving out of bed early in the morning, or you can say in simple word you can remember morning diarrhea, that is allosoc, sulfur, podophyllum, thuja, bryonia, nux vomica, netramsal. These are the most commonly used medicine for morning diarrhea. In case of allosoc and sulfur, both are suffering from driving out of bed early in the morning. For comparison, you have to remember sulfur patients gives the history of suppression of skin disease. In case of allosoc, you will rarely get this symptom. Suppression of skin disease, history of suppression of skin disease along with driving out of bed early in the morning, along with redness of all orifices is the indication of sulfur, baby or sulfur patient. And sulfur patient, you will get also the aversion to bath. But this aversion to bath you will not get in allosoc. In case of bryonia, for early morning diarrhea, the most common symptom of bryonia is aggravation from any motion, aggravation from any motion and ameliorated by absolute rest. In case of bryonia, when the patient wakes up and he or she lies in the bed quietly, he or she will not get the urge or feel the urge for the stool. But as soon as after waking, he or she moves, then he or she will feel the urge for stool. In case of netramsal, whenever the patient in the early morning, whenever patient gets up from the bed and walks for few seconds or a minute, you can say the patient feels urge for stool. Simply you try to remember, in case of bryonia, as soon as the patient moves into the bed, feel the urge. In case of netramsal, whenever he puts feet into the floor and walks for few steps, the netramsal patient will feel the urge. In case of nux vomica, there is also morning diarrhea you will get, or diarrhea symptom you will get. But in case of nux vomica, you have to remember single word, ineffectual urge, not single, two words, better to say, two words, ineffectual urge for stool. That means nux vomica patient always will take more time into the toilet for passing stool because of feeling or because of this ineffectual urge. Ineffectual urge means that patient feels that he would pass more stool, but it is not coming out. This is called the feeling of ineffectual urge. That is why nux vomica patient would take more time into the toilet for passing stool. In case of podophyllum, it's diarrhea related to you can say diarrhea immediately after eating, morning diarrhea, and it is profuse in quantity, polychromatic in color. Polychromatic in color means stool is different color. Stool is of different color and it is profuse in quantity and very putrid. Putrid means very offensive stool. Along with this medicine, you have to remember for your early practice related to the diarrhea, most commonly in case of children, the name of the medicine is acid phos. In acid phos, you have to remember two words: non-debilitating diarrhea. In commonly, you'll get in your practice whenever anyone passes loose stool 3 to 5 times in a day or in a half day, it is more common that he or she will feel tired, lethargic, weakness. That means he or she will feel shorts of dehydration. But it has described by perhaps Kent or Tyler that a mother came in your clinic and the mother is commenting that the baby since morning passed stool 18 to 20 times with large quantity. It is the complaint of mother. Baby had passed stool 18 to 20 times since morning, but you are observing that the baby is playing in your clinic. That is the simple example of non-debilitating diarrhea, the most important symptom of acid phos. Another commonly used medicine in your practice life, it may be the infant, maybe the children, or maybe the adult, that is protontic. In case of protontic, you have to remember the jet-like stool, the word jet-like stool. Now, jet-like stool means, see in this picture, the way of passing stool is jet-like. That is, while passing stool, the stool passes out with very speedy and along with a sound, great sound. This is called way of passing jet-like stool. Now, the other medicine you have seen perhaps in this slide, from aconite to stramonium. The other medicine I have also noted, aconite. It is also mostly related with the atmospheric change. The baby suffers from loose stool due to atmospheric change. In case of argentum natricum, two kinds of diarrhea you will get, nervous diarrhea and the actual diarrhea. In case of arsenic, mostly you will get in your practice life arsenic diarrhea is related to the simply food poisoning. I think time would not permit to describe elaborately against every medicine. That is why I am giving a simple tips for understanding or memorizing. Arsenic is mostly related with the food poisoning. Measarium is related with the mostly post-vaccinated diarrhea. In case of natrum mur also you will get diarrhea and the lack of confidence in the sphincter ani. Along with the natrum mur, general symptom pulsatilla, staphysagria, and Chamomilla ipecac mercurius sorinum rheum stramonium. Try to remember these medicine along with their important symptom. Try to make a notes yourself for your betterment of early practice life. It would, this medicine will help you in your practice. The another important medicine I would like to request you, if you have time, try to go through the Tyler's Materia Medica and try to open the Hyoscyamus. There you will get a case described by the Tyler. The baby passed involuntary stool from excitement and jealous. Excitement and jealous. Due to jealousness, related excitement, baby passes involuntary stool. The case was cured by the Hyoscyamus. If you have time, you can go through the Tyler Materia Medica for this symptom, or you can simply remember passes loose stool in case of children due to its jealousy. The medicine is Hyoscyamus. It is described by the Tyler. Another two medicine, if not if I should discuss before you, the most commonly used medicine related to the diarrhea of children, that is Chamomilla and ipecac. Chamomilla and ipecac. Most commonly important medicine, specially related to the green stool. I would like to request the student, these two medicine also important for your practice life. Try to make a comparison amongst these two medicine, Chamomilla and ipecac. I am giving you the simple or commonest indication. In short, Chamomilla, baby diarrhea causes by anger, and crying of the Chamomilla is, you can say, snarling cry. snarling, snarling cry. The meaning of this snarling cry is the cry of the baby is so irritating. Crying of the baby is so irritating, or baby is so irritable, so snappish. Even parent tells the baby why this baby is not dying.
Excuse me, sir. How much time will take the slides finish?
The slide finish will take time. It is also difficult for me to comment.
No, it's already 1 hour 15 minutes. We have one interactive session because children they have the doubts, no, and then we want that also. If you can, conclude and then interactive session, they have lots of questions. And is it okay for you?
No. One thing, I can just a second.
Yeah, it's okay.
No,
It's
no,
okay,
no,
sir.
no, no,
Take
no,
your
no,
time.
no. Oh, I can conclude with this slide because I have at
Okay.
least,
Yeah.
I have at least, no, I have just completed my 10% slide. Okay, so it would not possible. And in this slide, I would conclude, and next we will discuss. Okay.
Okay, and then they can question session or interactive session we can start, no?
Yes. I will just, I will take just 5 to 3 minutes to conclude.
Yeah, it's okay. Okay, sir. Thank
Okay.
you.
Now, you see what I told. In case of chamomilla, the term you will get in your materia medica, that is snarling cry. I repeat, snarl, snarling. Snarling cry means simply you try to understood that the way of crying is unsympathetic. Unsympathetic means, say, I am giving the opposite word before you, pitiful cry. In case of pulsatilla, you will get the pitiful cry. The say baby suffer from diarrhea, pain in the abdomen, and a baby of pulsatilla is crying in front of you. Yeah, he or she will cry in this way. Oh mother, oh mother, oh brother, I am suffering from pain, abdomen. This is called pitiful cry. That means the baby craves for sympathy. But in case of chamomilla, the crying is, I could not show you. In this way, with high volume, if anyone cry, no one would be the sympathetic to that particular baby. This is the meaning of snarling cry. In case of pulsatilla, everyone will become sympathetic to that particular baby. This is the basic difference in between pulsatilla and chamomilla mental symptom, along with its any kind of physical symptom. And please try to go through in details chamomilla and ipecac for comparison in your practice slide. And please try to make a note. Along with this, from my part, I would like to conclude. Thank you.
I hope you all enjoyed this session. Thank you so much, sir, for giving such a nice explanation on this topic. We are in the end of this session. I welcome Miss Lakshmi Saigal to deliver vote of thanks.
Good evening,
Sorry.
everyone.
Before that, anyone have any doubts, you can unmute your mic. If you have any queries regarding the topic, just click on the hand raise option. We will unmute you. Hello.
Yeah,
Anyone have questions,
Priyadashini,
please
continue.
in the chat box.
Roy Thomas has raised his hand. You can unmute by your side.
Evening, sir. Sir, I have a doubt that I have studied that Sina, homeopathic remedy, Sina Martina, can be used as an epidemic remedy when adults require that. How is it very practical, like even in COVID situation also for children instead of
Hello, your voice is not audible.
uh,
Clearly audible.
sir, sir, is it audible?
Not clearly audible.
Or else you can put in the chat box your question.
Okay.
Hello. It's Lakshmi Saigal. Sir, which potency do you use, and also the duration of repetition? For giving the answer of this particular question, it will take very long time, because which potency do you use? There is no fixed rule that I would use that particular potency, say from 6 to 10 potency. It depends upon the cases. Clear? And I do not know whether you are a student or doctor. Hello, Lakshmi Saigal, you are a student or doctor?
Sir, I'm a student.
Oh, student. Then I understood your question. You please go through the organon of medicine and try to study the way of selection of potency. You will get the conception. Clear? As a doctor, I should say there is no fixed potency in any cases or any medicine you should use. It depends upon the cases, and for the selection of potency, you may request the organizer for organizing a session. It will take a session at least for clarifying this answer. If necessary, I would available for discussion in that session. Okay.
Yes, sir. Thank you, sir.
Next question: can we give Sinametrina as a remedy for COVID in case of children? In homeopathic point of view, you can give any medicine for any diseases if the symptom similarity of the case you will get. Say for an example, a patient of COVID-19 giving you the symptom of sinna, that is desire of the sinna, extreme craving for sweet, nose pricking, constantly pricking the nose, lies the baby or patient lies on the abdomen, the baby is very sensitive, cannot allow to touch here, and the other symptom of Sina, if you get, you will able to get Sina, even you will able to get any medicine if the symptom persists, or if you get the symptom similarly. You got the answer? 64 Roy Thomas.
Yes, sir. Yes, sir. Yes, sir.
Okay. Next, Shalu Rajan to everyone. Roy, put question session in chat box. If okay. Any question? Any more question?
Dr. Anand Jaiswal, you can unmute your side.
Hello, I am audible.
Yes, audible.
Yes, yes.
Sir, most difficult case to treat the patient is infant because they unable to express their symptom. So in what hello?
Yes.
Sometimes infants is very crying, unable. I don't know how to examine in such case. Sir, is there any preferable book? Anything, sir? You can guide me in such case because it's very difficult to treat him.
No. I understood your question. That is why in the very first page of my slide, I told the word observation. And this observation will help you for finding out the symptom indication. Say for an example, an infant is crying or a baby of 3 months is crying. He puts his hand in this way while crying. This will help you that to identify or to understand the baby have some problem in the ear. Clear? If the baby, sorry, in this way, the position of the baby, attitude of the baby will help you for finding out the symptoms. And the attendant will also help you for getting out the symptom or finding out the symptom. For an example, the mother or grandmother saying, the baby sleeps all the day. He or she has no problem. He become quiet and calm during the day, but as soon as the night starts, the baby started is crying. This is the indication given by the parents or the attendant. We have to depend upon the mostly on the parents or attendant, you can say, and the behavior of the baby and observation of the physician. And I understood your question. Frankly, I have not got any particular book which will or which helped me to find out your question answer. These are the just personal experience or experience gained from our teachers. There is no particular book I have seen. Hello.
I hope all have cleared their doubts. Now I welcome Miss Lakshmi Saigal to deliver vote of thanks. Lakshmi, please.
Good evening, everyone. On behalf of all, I would like to thank Dr. Narayan Debnath for his wonderful session on homeopathic treatment in children for beginners. Sir, it was really a useful session for us. It helped us to know how to approach the treatment in case of a child and also the important points which we should note in case of remedies and also how to differentiate between the various remedies. Thank you, sir, for this wonderful session. I would also like to extend my sincere thanks to the participants who have attended this session. And last but not the least, I would like to thank the coordinators of Ifph for organizing such wonderful sessions for us each week. Once again,